Can you believe your mental status can be examined by 10 to 15 minutes? Yes, it can be happened by mini mental status examination, MMSE. Myself Sumar, I am the student of occupational therapy. This MMSE was developed by Marshall Falstein. It is also known as Falstein test. So MMSE can also be called as this. So it has 30 questionnaires. It is asked to the client. Before administering the MMSE, we have to do something. So first we have to sit the person in front of us and facing us. So like that we have to make the person sit, and then we have to analyze. We can understand what we are speaking and they can hear what we are speaking, like that. If they have any auditory or visual problem, we have to give the aids first, then only we can administer the MMS. So and also we have to introduce ourselves, so to make a confidence of the person, and we can repeat 3 times a question. So if the person can't able to understand, we can able to 3 times repeat, but don't repeat more than 3 times. If the person capable to understand, we can tell we are going to assess your memory and we are going to ask a question, like that we can tell. If they can't able to do, we can start the MMSE and administer it. If the person answer incorrectly, don't repeat the question, we have to put 0. If the person interrupt while we are asking, just say please wait a moment, I will be finished in just a moment, and then ask full question, then allow them to speak. What are all the categories of MMSE? Has some categories like appearance, orientation, registration, attention, recall, calculation, language. These like categories are present in the MMSE. We have the MMSE sheet. In this, all these components are given and each scoring are tabulated. So our work is to just ask the person questions and just fill the scores and calculate the score. That is our duty. Then we have to discuss about the what are all these categories. Let's start with the appearance. So first in appearance we have to notice 8 things in the client. So what are all the things? First, appearance of the person is started with age category. So first we are just look at the person and understand the age of the person. So then physical feature, first age, then followed by physical features. So how their body, so they some person have almond shaped eyes, like that. So physical features are noticed. Then grooming level, so how they are grooming themselves. So the grooming level is checked, and then their dressing. So they have dressed the appropriate level to the weather and the situation. So these are all noted. Then observe the body language of the person and how they are comfortable with the social. So in their society, how they feel comfortable or uncomfortable. These are all noticed. And they have make the excessive movement or they don't maintain the eye contact. So these are all noted in the appearance category. Then orientation. We can divide the orientation into two: temporal orientation and geographical orientation. In temporal, what is the year, what is which duration. So duration are come in the temporal. So which season is this, which year is this, which date is this, like that, and which month is this. And in geographical orientation, we can ask which area you are, what is this area, and which state you are, which country you are, which planet you are, like that we can ask in a geographical questions. Maximum score is 5 for the orientation. And registration, so first we have to tell the 3 names of the object, any object like switch box and a light and a phone, like this. So we have to name the 3 objects, and the person have to repeat the same object. So they have to register the object name, like that. Maximum score for registration is 3. Then attention and calculation is finished by the single task. First we have to ask the person to subtract 7 by 7 from 102. So 193. So like that they have to subtract. So 5 repetition. So 193. Like that 5 numbers they have to tell and spell alternatively. So world is the DLROW. So like that reverse spell. So these are all noticed. So how they are respelling, how they are reverse the spell. So these are all noticed, and maximum score is 5 for the attention and calculation. Then followed by recall. So just now we are the 3 things. So switch box, cell phone, like that. So the person have to repeat and recall what are the things they learned. So by this we can recall, we can assess the recall. Maximum score for recall is 3. And final category is language. In language we have to notice 6 points. First, naming. So in their language they have to name. So if the person talking Tamil, so they have to name two objects. So the score is 2. If they tell the name of the two objects, then the maximum score is 2. Then repetition, you have to tell something and the person have to repeat. So in this, no any interruption. So if they repeat, they have the score. So maximum score is 1. And third is command. So we have to give a 3-stage command. So take your place your index finger of the right hand on your nose and on your ear. So like this 3-stage command is given to the person, and if the person executed it, we have to give the 3. Maximum score is 3. Then we have to notice reading, writing and copying. So in reading we can use close your eyes in capital letters. So if the person read it and do it, so that is a task. If they do it appropriately, they have a full score. If not do, they have a less score. Then reading, maximum score of the reading is 1. Then writing. So writing is started with a blank paper. So we have to give a blank paper to the person and with a pen. So they have to write something. So in this one subject or one verb should be present. If these are not present, they have a good ability to write. And then copying. We use a pentagons. So intersected pentagons. So they have to copy the intersected pentagons. If they copied appropriately, then their score is 1. If not, 0. So like that, reading, writing and copying are all 1. Maximum score is 1. So at the end we have to totalize the scores. So total score, maximum score is 30. So and their total score is calculated. If their total score is above 25, so 25, 26, 27, like that, then the person have no cognitive impairment. If the person have scoring 19 to 23, then the person have mild cognitive impairment. If the person have 10 to 18 score, then the person have moderate cognitive impairment. If the person have below 9, so they have a low score than 9, then the person have severe cognitive impairment. So this MMSE can be easily and quickly performed, and it has not needed any other biggest materials. So we can easily assess by using the MMSE. So disadvantage, it is not helpful for the visually impaired persons, and we can't able to examine the visual spatial skills in a wide manner. So we just little manner we just examine the visual spatial skills, but we don't go into the depth. And the poor education people can't able to read and write, and they can't able to count like this. So number knowledge, so mathematical calculation, weak people are not getting enough nourished by the MMSE, and this MMSE scale is copyrighted. Okay, in our video we just discussed about the MMSE scale. So it is used for the cognitive testing. So I know you are getting enough information by our video. Be proud to watch our video. Thanks for watching. Don't forget to subscribe our channel. Subscribe now and click the bell icon now. Okay, are you done it? Okay, very good. I will meet you in next video. Thanks for watching.